we want to do quickly before we do anything like a mental health check. So in the chat room, just in 3 words, describe how you are feeling currently. So let's all do that.
Hi, Julie.
Hi.
Hey, how's it going?
Hey, Julie, welcome.
Thank you.
So right now we're just gonna ask everyone just do a quick mental health check, describe how you're feeling in 3 words, and you can put it into the chat room below. And it's gonna give you an option to send it to everyone. So just 3 words. Yeah. Yep. So 3 words on how we're all feeling. All right. Cool. All right. And as people are joining, we're just doing a quick mental health check. So describe how you're feeling in 3 words. And so any 3 words that come to your mind, write it in the chat room below to everyone. And then we'll get started shortly. Give it like maybe another minute. Hey, Raina. Welcome as well. Cool. So, yep, let's do. All right, let's talk about why we're here. So, hi, I'm Eric. For those of you who don't know me, I am the co-organizer of Waves, which is a roundtable kind of session that we run here in New York, but also now we're trying to do one in LA as well as the Bay Area. And you know, we meet together to talk about mental health in the Asian American community, obviously because there's a lot of stigma around it, but also it's just challenging, right? And I think especially during this time where everyone is isolated and quote unquote like quarantine at home, we are in need of this even more, right? And I think there's an urgency that the community has to come together to talk about our mental health and how everyone is doing, and to know that we're not alone. Especially as Asian Americans, I think there's just a lot of challenges, right, for our community. And so we wanted to invite mental health experts to actually talk to us, as well as offer this space for people in the group, right, to share about how they're doing, how your experiences have been thus far. And so this space is for you guys. And we want to keep this as informal and as casual as we can. And we have some prompt questions that hopefully will engage us and keep us relaxed. So that's why we're here. We wanted to do a quick intro of all the mental health experts on our panel. We have actually quite a few. So let's do this from Yuna and then down. I hope this is in the same order. Oh man. But let's try to do a quick intro of what's your name, what do you do, where are you from, and then favorite candy. I don't know. All right, let's do it.
All right, I'm Yuna. I'm a social worker. I've for the past 5 years, 5+ years at Rikers Island. So this is kind of similar in some ways and quite not in some others. I'm kind of used to just being stuck. And favorite candy, Twix, I guess. That's the first thing I can think of.
Awesome. Chris, I'll just call it out actually. That's easier.
Okay. Good. It's not morning, it's afternoon. Hi, everybody. I'm Chris. I'm a
a therapist in private practice. My offices are located in the financial district. My favorite candy is the peach rings by Haribo, I think.
So good.
Yeah.
Carolyn. Carolyn, I think you're on mute.
Yeah, just getting my microphone to work. Hi, everyone. My name is Carolyn. I'm a licensed marriage and family therapist. As of last year, I've worked in different clinical settings, and I think one of the main reasons why I got into this group and passionate about this profession was because in my family, they are all healthcare professionals in primary care. And, psychology was always second. And a lot of times I think, we would just as a family and as a community internalize our feelings and really blunt them out. And so just, being in that background helped me to really appreciate my role as a mental health therapist in primary care as well as in the Asian community. And my favorite candy is Reese's Peanut Butter Cups.
Henry.
Hi, my name is Dr. Henry Zhu. I have a PhD in clinical psychology. I'm currently a postdoctoral fellow, and I'm part of this because mental health is really, really important, and we don't talk about it enough in our communities, point blank. And favorite candy, I'm going to have to go with Yuna here and say Twix.
Dan.
Hi everyone, I'm Dan. I'm a clinical social worker working in community mental health with young adults and adolescents. I'm also struggling with the flu, so if you hear that, that's what it supposedly is. So I also do private practice consulting and community organizing around cultural competency, anti-racism, and private practice therapy. And my favorite candies are usually peanut butter based or dark chocolate based. So anything that kind of fits that category.
Winnie.
Hi, my name is Winnie. I'm a registered nurse at the NYU Langone Hospital in Brooklyn. And I currently work on an acute inpatient rehab unit that focuses on stroke patients. I've been a nurse for just over a year now. And I say my favorite candy is probably anything sour, like Sour Patch.
Jed.
Hey, my name is Jed. I guess why I'm here is because I help to run Asian Mental Health Collective, and I'm passionate about mental health. Well, it's a long story, but the short version is that I want to help kind of grow healthy communities and a healthy society. And I am a therapist. I work in private practice in Los Angeles.
Andrew.
Hey everyone, my name is Andrew from New York. I am a licensed marriage and family therapist. I work predominantly with young adults, adolescents, especially through the family systemic lens. I'm here because very passionate about just advocating for mental health within the Asian community, and hope to one day be a really huge staple therapist within the Philippine community here in New York. And favorite candy has to be, right now it's going to be sour Skittles.
Anna.
Hey guys, I'm Anna. I'm a third year medical student at Rutgers. I'm kind of based out of the East Coast, but I'm from the West Coast. I'm applying psychiatry next year, and I am thinking about doing child adolescent. Yeah, it's actually one of my classmates here who's a participant too. I'm calling out Grace. Yeah, but I'm here for kind of like a medical expertise. If anyone has any questions about that, that's
Awesome. So that's our panelists. Thank you guys for joining. We really appreciate your time. Now we'll do a quick mindfulness exercise because I feel like I saw a lot of nervous, I saw a lot of distracted and anxious in the comments. So let's lead that off with Carolyn.
Okay, so today I'm gonna lead you guys through a progressive muscle relaxation exercise. So it's an exercise that reduces stress and anxiety in your body by having you slowly tense and relax each muscle. And the purpose of it is to provide immediate relaxation, but it's best to practice frequently. So if you guys haven't done it before, this is your chance. I think with experience, you will become more aware of what you're experiencing tension and the skills that will help you relax. And during this exercise, each muscle should be tense, but not to the point of strain. So if you have any injuries or pain, you can skip out on those affected areas. But I want you guys to pay special attention to the feeling of releasing tension in each muscle, as well as the resulting feeling of relaxation. So this will take about 5 minutes. So let's begin. So first, let's start by sitting back or lying down in a comfortable position. And you can shut your eyes if you feel comfortable doing so. Begin by taking a deep breath and notice the feeling of air filling your lungs. Hold your breath for a few seconds. Release the breath slowly and let the tension leave your body. Take in another deep breath and hold it. Again, slowly release the air. Even slower now. Take another breath. Fill your lungs and hold the air. Slowly release the breath and imagine the feeling of tension leaving your body. Now, move your attention to your feet. Begin to tense your feet by curling your toes and the arch of your foot. Hold on to the tension and notice what it feels like. Release the tension in your foot. Notice the new feeling of relaxation. Next, begin to focus on your lower leg. Tense the muscles in your calves. Hold them tightly and pay attention to the feeling of tension. Release the tension from your lower legs. Again, notice the feeling of tension. Remember to continue taking deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel tenseness without going to the point of strain. And release. Feel the tension leave your muscles. Now, begin to tense your stomach and chest. You can do this by sucking your stomach in. Squeeze harder and hold the tension. A little bit longer. Release the tension. Allow your body to go limp. Let yourself notice the feeling of relaxation. Continue taking deep breaths. Breathe in slowly, noticing the air fill your lungs, and hold it. Release the air slowly. Feel it leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can without straining and keep holding. Release the tension from your back. Feel the tension slowly leaving your body and the new feeling of relaxation. Notice how different your body feels when you allow it to relax. Now, tense your arms all the way up from your hands to your shoulders. Make a fist and squeeze all the way up your arm. Hold it. Release the tension from your arms and shoulders. Notice the feeling of relaxation in your fingers, hands, arms, and shoulders. Notice how your arms feel limp and at ease. Move up to your neck and head. Tense your face and your neck by distorting the muscles around your eyes and mouth. Release the tension. Again, notice the feelings of relaxation. Finally, tense your entire body. Tense your feet, legs, stomach, chest, arms, head, and neck. Tense harder without straining. Hold the tension. Now release. Allow your whole body to go limp. Pay attention to the feelings of relaxation and how different it is from the feeling of tension. Begin to wake up your body up by slowly moving your muscles. Adjust your arms and legs. Stretch your muscles and open your eyes when you're ready. And that's it. If you guys found that helpful, you guys maybe can write how you felt afterwards in the chat section.
Awesome. Hopefully everyone feels a little less anxious, a little less distracted. Yeah, I feel calmer already. Like, yeah, it feels good. But for those of you guys who just joined, thank you for joining. We have joined here a lot of our mental health experts in the Asian American community to share their experience, but also this is a space for you guys to share how you've been doing, right? Everyone's probably home in their living rooms, right, watching or calling into this, and so we're excited that you're here. We're gonna quickly go through some ground rules. Like I mentioned before, we wanted to create the space to be cathartic, to be kind, to be positive, uplifting, right? There's a lot of kind of noise out there right now that could be very heavy, and so we want we want this space to be as encouraging, as supportive as we can, and that's what we have some experts here to hopefully provide that, right? Be respectful, obviously, right? And yeah, we want to encourage inclusivity, and this is not a replacement for therapy, and so everything that is shared here is on personal opinion and personal sharing. And this will be recorded, and so this is going to be posted afterwards. So if you are uncomfortable, yeah, feel free not to share. You're not forced to, but this will be shared to the group afterwards. All righty. So I wanted to start off asking the panelists, and we got quite a few. So we want to ask first, just generally, how is this affecting you personally? right? And as an Asian American in this community, how have you kind of received that as well? But just curious, like, how are you guys doing personally?
Hold on, real quick. How to use Zoom for a quick second for how we're going to kind of manage this. If you want to share, just click on the participants participants tab, and then you should have an option. It'll pop up like a little sidebar on the right side, and there should be an option to raise your hand. And we'll be watching the list to see people who raise their hands, and then that way it'll be easier for us to kind of call on somebody to have them share. That way it's not just people trying to talk, and this way it'll be a little bit more organized. And other than that, I think that's the only thing that I needed to like share. So yeah.
If you guys have more questions, we could put it into the chat room and we'll have some moderators help address any technical issues, but we're doing it as we go. So let's do this. Yeah. So how is everyone doing? How are you guys handling this, and how has this affected you?
I guess I'll go. I had to really try to compartmentalize my feelings and how I'm going to interact with people who are processing differently from me. I think it's all about trying to find balance and trying to feel like it's normal that we are feeling this way. And that there's a difference between not being in control of something and like feeling powerless, you know. And also to kind of know that, yes, the reality is social distancing, but that doesn't mean the same thing as social isolation. And, you know, just like we're doing right now, we're finding different ways to connect. So part of my time online, like when people are posting things, like I've discovered little creative things people do. My high school, for instance, is using Minecraft for their prom and graduation. So that was interesting, you know.
Awesome. Thanks for sharing. I think Henry also wanted to share.
Aside from my mom having to tell me every like 5 seconds to wear like a face mask when I go outside and to wash my hands. Last week it was business as usual. I was still going into the office, and this week it felt very, very different, right? It feels like news is coming in really, really quickly about what we need to do, and it can feel very, very overwhelming. I know I felt overwhelmed this week, and so I think that this is a time for us to not only band together, but also to think of creative things, like the Una said, creative ways to adapt to something that we feel like we have no control over. And so I just want to thank everybody for being here.
Awesome. And I'm seeing some chat messages come through in our room, and Steph wrote to speak up for others, to defend others. Yeah, so if you have things that you'd like to share in the chat room, feel free to do that as well. Christian.
Yeah, so I think on my end, I was supposed to actually go back to New York this weekend to visit family. Just recently moved out here about 4 months ago now, so I was looking forward to it, especially it's a hard time for my family right now because my dad is a nurse, so he's been in contact with patients. And then my niece, she has cancer right now, so it's one of those things where we're kind of going through. It's hard not being there for my family, but then just not being able to actually be there at all has been really tricky in light of all of these developments. But, yeah.
Yeah, thanks for sharing. We want to also give space for people on the line and in the meeting to also share. So if you'd like to share kind of like how you're doing and how you've been dealing with this, yeah, feel free to kind of raise your hand. And I think Jed was explaining that earlier. So if you have issues on that, you can go to the chat room. But yeah, we want to keep this as informal and open to kind of, right, anything that you've been experiencing thus far. Cool, Raina.
I think for me, I'm still settling into like adjusting to staying at home most of the time. And then something that's been difficult is balancing how much I'm on social media because I want to know what's going on and the latest news and like the numbers and what's best to do. But then also it's very, very anxiety provoking. And I think it's hard for me to even put down my phone because I just want to keep scrolling and looking. So I think that's something I'm struggling with.
Yeah, no, thanks for sharing. Okay. Winnie.
Going off of what Raina said, I also feel the same way. And fortunately, this past week, I've been able to stay home as one of my weeks of vacation for the year, but I had to cancel plans to go somewhere. But as the week was going on, I was like, I'm trying to relax and not think about it and take a break from the news and social media. But at the same time, I feel helpless and I feel like I want to do something more. And then even though I'm trying to rest and relax, I'm becoming increasingly anxious as I approach going back to work on Monday. And just from family worrying about me or me worrying about bringing anything back to them that I might come into contact with at the hospital has been very hard. And it's just hard to find a balance of how much information I want to keep up to date with, but at the same time, it's my job to keep up to date with this information and know what's going on at work. So yeah, that's been very anxiety inducing.
Yeah, I don't think you're alone for sure. Everyone definitely feels that anxiety. Steph, I think chatted anxiety is up the roof. Yeah, so hopefully we'll try to calm a little bit of that today, right? Anna. I think you're on mute.
You're muted.
Just kidding. Okay. Yeah, just to double bounce off of what Winnie said, as someone who's also working in the healthcare field, especially as a student, I think there's a lot of like a huge amount of confusion over whether we would stay, given that it is a real healthcare crisis and it is a good learning opportunity. But also just the practicality of putting us in danger. And I know my talking to a lot of other kids, our parents are really worried. It sucked to see my parents so concerned for my health and safety, and I did actually end up coming home, and I'm currently living in a separate section of the house to quarantine myself for 14 days, and it's just I would definitely agree. A lot of the anxiety is like kind of a baseline. It's always there. But like she said, some of it is practical. You do need to stay up to date. I basically just agree. It's hard finding the balance.
Yeah, and you mentioned something about the dynamics between like parents, right, and just friends and family in general. And so the next question is, how has this affected your immediate circle of friends and your family members if you are staying home? How's that been going?
I guess this kind of goes back to talking about compartmentalizing feelings. So I just wanted to clarify that. It was that I think we just needed to acknowledge our humanity. And what I mean by that is both that we are going to feel all these feelings, and we are extremely good at feeling guilty for feeling all these feelings, in spite of the fact that we are living in a very abnormal situation. At the same time, we can go the opposite way where we are extremely resilient. And it is pretty much, I mean, so I just from, just from stories you hear on a regular basis, people are able to adapt, right? And I think it's just the ability to believe that, that's the key, because it is very difficult to imagine things getting better. Like for some people, especially when things are very difficult, I think that's when believing that is the most important thing. So I guess to answer the question about how that affects friends and family, I think that people will be at different places for that. And one thing that we can all do is think about what is the best way to support my mental health and what is the best way I can support other people's mental health. And a lot of times that means that, people will look at it differently or want to share on a different level or want to know things at a different level, etc. So all those things, like just being careful and recognizing our humanity.
Yeah, I love that. I think there's so much resilience, like you said, to what we can do, especially as we, as we bring, I guess, our kind of efforts and our energy together. Anna.
I see in the chat there's a little bit of chatter about conflict with parents, and I think as I'm Chinese American, but I think a very common theme with our generation is this culture clash with their parents, right? And for a lot of us, the solution was to have independence, to go to college, to live separately. And in this situation, I've heard from a lot of people who have, being forced to live in close quarters with family members or really anyone, partners, anyone who can be a source of stress is absolutely a huge challenge. Yeah. Not sure what to do about that yet, but yeah.
Henry, thank you for sharing.
One of the challenges that I've had to endure, or I'd say endure, but is that usually I'm the one who has to reach out to my friend groups to kind of check in on them. And I'm sure that you guys have had to do something similar. And while it's easy to feel kind of sucked up in all the negativity of the news, right? I think it's also important to be grateful for everything that you guys have, but also to know that there are some like movements out there that spread positivity, like hashtag wash the hate. It's like a movement that is sort of like a PSA for washing your hands for 20 seconds, but it's Asian American like celebrities trying to like wash the hate away. And also on a lighter note, the Vietnamese dance challenge for washing your hands is awesome.
Oh, yeah.
You guys should totally watch that. It's great.
So much to share that in our chat room. Awesome. Carolyn.
Let me unmute. Okay. So yeah, I think actually from my experiences, I've seen people starting to communicate more and check in with one another in ways they really haven't before, as well as just grow a little bit more just compassionate and empathetic of what others might be going through, that even if maybe somehow they're benefiting from the situation by having time off of work, that other situations, other people might be actually facing, real challenges and changes. So I think that's really nice to see. And I think, there's been just virus epidemics that have happened in the past, like with SARS and H1N1 that have been mostly kind of just localized to Asia. But, now that it's a very global thing and it's affecting all of us, definitely we're all feeling it too. And I know that there's this shelter in place, but I think, a lot of just going through it is just, helping us become, instead of, America, more collectivistic instead of individualistic as a society, focusing on the group goal and versus less about, basic biological needs like, you know, buying food or tissue paper and, having hoard. And I think one thing that's, just really that I've seen with people in my community is just maybe just reframing the language of, our inner dialogue, and being intentional about what we do instead of we're forced to stay at home. We have the shelter in place regulation going on that, we're choosing to do this and we're choosing to do that for, others that we care about, our parents or elders that are older than us, that are more susceptible to the illness.
Yeah, definitely. Andrew.
Yeah. I think what's coming up for me in regards to sort of like this micro community of friends and family, just sort of echoing, what I think we've heard a lot here between the panelists, which is there's this love that I'm noticing a lot more present itself within my family. I don't know if who here can agree or have a similar experience, but in my family, being Filipino, being Asian, like there's not a significant open expression of emotion. Sometimes, especially the males in my family, that could really be suppressed, or covered by laughter. And I thought it was this really huge display of love, like when my dad called me, which I don't get too much. He lives in another state, and I'm just seeing a lot of these different generations. If it's my father and his mom, and even across the family system, there is this sort of band, to really just try to band together and, take care of each other. It's not to undermine the severity and the concerns of the virus. I just think it's also important that we recognize those pockets of silver lining, throughout all of this. So it's definitely inspiring to see that, and similar to, what we're doing here. I'm glad that we're all together speaking about this and sharing what's coming up for us.
No, yeah. Thanks for sharing that. I think that's definitely a common sentiment that most Asian American families definitely experience. And I think moving on to maybe now we're kind of going bigger into our community, right? Our friends, families. And I guess just as the AAPI, the Asian American Pacific Islander community, how has this been affecting us? How do you think that's been happening? Yeah, Dan?
Hello. So, I think first of all, I just want to say that there's been so many conversations lately that, they really all come from many different places. And I think I want to just say that it's shifting the conversation a little bit more in terms of putting racism and xenophobia in the spotlight. And I think it's kind of important to really break it down a little bit in terms of how we want to look into the nuances of it. So I think I want to share first ideas, right? The first level of oppression is about ideas, how we think about it, power and prejudice, how this all started. And, it began with anti-Chinese sentiment that then became generalized towards other people who look Chinese, right? And that's something that's historically based on the way Asian Americans are lumped in a group. You don't talk about Vietnamese or Cambodians or Malaysians or whatnot, it's one group. And so the way that America historically operated from a sense of dehumanizing, got deviated from the dominant group, which is white men. And now we're seeing an addition of a trait to a virus, calling it Chinese, and then that's being generalized to people perceived as Chinese. And so bodies are being policed as viruses rather than people. And the second piece of it is xenophobia, how it's been part of the United States sense of othering. And that just makes it easier for people to blame, right? The idea of the yellow peril was hysterical, and that's been part of America early on. And so if you take these types of ideas and apply it to an institutional level, this is when rules, policies, laws get put in place, and then people in power who say things can become de facto rules too. So Trump calling it the Chinese virus becomes something. Banning flights from China first adds to this narrative, right? Laws throughout American history, the Chinese Exclusion Act and other areas, right? The recent deportation laws, the recent Office of Denaturalization, these all kind of add up towards how people are being treated now. And, even if you think about the health policies, right? It started with, if you've been around anyone who's been to China, take some precautions, right? And now healthcare and mental health care are being affected tremendously in terms of how we deliver services. And I also just want to note that it's just really interesting to see what laws can be waived to do what needs to be done to help people. And it showcases that if enough people care, people in power can actually make changes, right? And so the third level is interpersonal. This is what most people know as racism. My friend who was spit on twice in the past 2 months because of what she looks like. The experiences I had being commented on the train when I cough. The experience me may have had being called chinks or saying we speak ching chong and whatnot. The TikTok videos, the memes, the jokes, right? Like that's what we're all used to when we think about racism. But there's also the final layer of racism, which is internalized racism, right? And in terms of superiority and inferiority. So people, for example, might start to think, if only I weren't Asian, I wouldn't be like this. And it would bring feelings of, oh, you not being who you are. You don't want to be who you are. It makes you question your identity. It makes you feel like you don't belong, that you're not going to have space in this country. If you even think about the media stories and personal experiences about the Black African Americans whom they believe to be the ones committing these interpersonal acts of racism, that fuels anti-Blackness in the Asian community, right? And that generates, ideas and laws that perpetuate when we are supposed to look at those other layers of racism instead, and really makes people look into their own relationship to identity, to loneliness, to hope. And this really kind of gives us all this sense of Asian Americans have this collective sense of trauma. And I think that's when people might start to internalize hopelessness. And I want to say that, like, these aren't the only things happening. And for a long time, people have been organizing. And now the positive part of all this is that it's been exposed, what's been going on for a long time, and has brought more people to do something about it. And this is happening, and I think this is so great. So, thank you guys for organizing this. I think I saw a nonprofit now keeping track of hate crimes are being committed. I think, personally, I've dealt with the voicelessness and powerlessness as a clinician, an organizer, and I think, at work, for example, kind of talking to a few friends and allies led to an agency-wide I Am Not a Virus event that really kind of helped other clinicians and leaders at my agency go out into the field. And, I really want people to recognize that, like, there's so many of these things going on, to not lose hope that there can be changes happening. And, all these people in this chat are proof.
Wow, yeah, no, thank you for sharing that, Dan. Claps. Jed.
I love that.
I think I don't know how to pronounce your name, but Deepankar has their hand up, and sounds like they would like to share something.
Sure. Okay.
Hey y'all. You pronounced my name fine. Thank you. I wanted to bounce off kind of like what was being mentioned by the last panelist. I think you hit on like every good point made, especially in the context of Asian Americans with a lot of other folks. So to give a little perspective, like I'm South Asian, and the odd part of the last 30 years when I hear about anti-Asian racism that's really public health related is that we're usually invisible because ours is usually sectored or siloed to the South Asian subcontinent, if that makes sense. Like if you hear about anything, it's happening there. It doesn't cross over to the United States. And so one thing I've been trying to do is, talk to fellow South Asians and West Asians and North Asians who, and the weird irony of like the model minority myth is like we're hella invisible. And I've had East Asian friends sometimes tell me I'm not Asian, I'm something else or something like that. But there's an opportunity for us as South Asians, North Asians, and West Asians to practice allyship. So um, I don't know if you guys live in white suburbia. I do. It's in Gurnee, Illinois. It's like 40 minutes into the suburbs away from Chicago. And one thing I see in these town forums is a lot of white folks, especially elderly white folks, passing these memes and stuff like that. And so me and a couple of other friends had ability to educate white folks because we were in that capacity, not that it's our moral responsibility to educate white folks. So there are opportunities where different demographics and sectors of the Asian diaspora can just like step up and just like say, hey, this is wrong, and we should be looking out for each other. And one thing the last panelist touched on that I also want to resonate was the issue of anti-Blackness. So a lot of fellow Asian activists on Facebook and Twitter have been sharing a lot of really great list of resources on like how to combat anti-Asian racism, how to support local businesses of Asian descent, especially East Asian descent, and also how to support folks who are going through the trauma. But one thing a lot of Black, Latinx, and Indigenous activists have also been saying is that it's time to show up for our issues as well, because when anti-Blackness is rooted in the United States through direct mid-Atlantic slavery, all the way to Jim Crow and mass incarceration, these issues do affect the Asian community. So there's a weird invisibility. Like when people talk about DACA or undocumented folks, there are Asian families affected by that. When people are talking about mass incarceration, there are Asian families being affected by that. There's a weird dual thing I'm really interested in like learning about and like working with other Asian activists is like, okay, how do we get the support we need right now and express that in a way that builds cross cultural community, like between different demographics in the United States and international, but at the same time when it's like there's like a racism moment that happens with each group that is either like a newer generation of immigrants or that depends on a historical time period or event. So for example, right now, East Asians are taking the brunt of the coronavirus racism, if that makes sense. Not to say that, oh, no one else is facing oppression. It just means that when that attention or spotlight unfortunately shines on a specific demographic, how do the rest of us kind of step up and say, we'll help out, we'll support, we'll be there for you? Because I think of moments like this back to, there's a, my neuroscience professor at my old college, she had this poster about, and I forget the source, but basically it mentioned that each line of the poem that it had was, first they came for, folks of Jewish descent. I was not, I didn't say anything. Then they came for Catholics. Then I didn't say anything. Then they came for LGBTQ folks, and then I didn't say anything. And the list goes down. And then the last paragraph was the poignant part. It said, then they came for me, but there was no one left to help me or support me or save me. And so I'm reminded of like cross solidarity in that moment, how it affected folks in the Holocaust, and how we can learn from that now so that, let's say 2-3 years from now, this all dies down, hopefully, and we get back to a sense of normalcy. When Black kids are being shot down by cops, when brown kids and families are being separated by ICE, when Native American families are just outright ignored in every statistic or in every service possible. I'm also interested in like learning how we raise voice for them so that we resonate equitably. Because at the end of the day, if we're not for each other or with each other, it's just beating and depressing as well. But yeah, that's just thoughts that just came through. Thank you.
Thanks for sharing, Dipankar. Jed.
Yeah, so yeah, thanks for sharing. I think this is kind of also an opportunity, like Dan said earlier, to kind of address trauma. Yeah, I think now is a great time to kind of take a step back and try to understand where some of, so I'm going to use a really lighthearted example for how small things like what we're experiencing, well, right now it's not a small thing, but how small things that we do during times that are kind of traumatic, like right now. For a lot of people, there's a lot of stress and a lot of anxiety going around, and that can manifest itself in trauma. And so one of the things that I kind of wanted to bring attention to is just in our Asian contexts, I think it's common knowledge that a lot of our ancestors, whether just like one or two generations back or many generations back, have had traumatic experiences that kind of live on in different ways nowadays. And one of the things I kind of wanted to bring attention to is the fact that it's a good time to kind of talk about how I guess a pandemic can help to bridge some of those intergenerational gaps, and to also kind of have conversations about like how we can be proactive in mitigating some of our kind of our transmissions of these behaviors. So one of the things that I'm going to use as an example is just kind of like as a funny example is just, so if you think about all the people who are kind of hoarding toilet paper right now, right? And you kind of start to think, oh, you start to panic, you start to have this anxiety about running out of toilet paper. You're going to, in the future, I'm not saying that this is necessarily going to happen, but as an example, right? If you continue to kind of hoard toilet paper, say you keep 1 to 2 extra cases of toilet paper just in case, right? And then that's just a practice that gets passed along in your family. That can be, in a very lighthearted way, a transmission of intergenerational trauma. You were traumatized by this event, this pandemic that we're experiencing, and you felt like there's always a possibility of a shortage of toilet paper. And so your family never understands why you continue to buy toilet paper. Your grandchildren will not understand why you always have toilet paper at home. And you might not necessarily understand why you have all this toilet paper at home, but it's just that kind of passive anxiety that you don't really bring to the forefront of your attention all the time that gets kind of transmitted. And I want people to kind of look at their own lives right now. It's a great time to like reflect and introspect because, well, there's not a whole lot else to do, right? So think about like the weird things that your parents do, your grandparents do, and you think about, oh, like, why do they do these things? There might be more serious behaviors that you can take a look at, right? But it's a good time to kind of think about why they're engaging in these behaviors that we feel like might be kind of weird or might be kind of problematic. And we take a look at it through the lens of their experiences, and we realize, oh, hey, like, oh, this kind of actually makes sense given what they've gone through. And I think, yeah, understanding that, taking this time to kind of bring a spotlight to that trauma, and how we who are, I guess, maybe not everyone, but say for using Dan's example earlier, right? Like xenophobia and racism, how a lot of people can internalize that. Like somebody experiences a traumatic event related to a racist attack against them, and now they have developed this distrust of a certain people group, or distrust of the system, or distrust of whoever, and that kind of gets transmitted along as well. And that idea gets passed from like family to family, from your generation to the next and the next after that. And nobody really has that, nobody down the line has that definitive ability to recognize where that came from. And if you actually were able to have that insight and to be able to preemptively think about it now, and kind of when things happen to you, how can I mitigate the effect it's going to have on future generations? And I think those are things to really think about. And it's really important to like emphasize how to maintain your own sense of self and your own kind of mental well-being in this time, because if we don't take care of that, we are more likely to pass on these potentially maladaptive behaviors. And yeah, I hope that this whole situation brings an opportunity for you to maybe talk to your families about things that you don't really understand, or things that you have problems with. I mean, it might be hard to do, but I mean, for a lot of us, we're spending extended periods of time regardless of whether we want to or not. And what better time than now when we're kind of united against this thing to have something to share and to be kind of connected over, and that kind of creates an opportunity to bridge gaps. And I think that, yeah, that's basically just what I wanted to share about this.
Wow, thanks, Jed, for sharing. Yeah, I think for me personally, you know, like my mom has been really obsessed with making her own face masks. And like you're saying in a very lighthearted manner, like if she continues to do this, I'm going to have a talk with her. So definitely noted for that. Christian.
Yeah, going on a bit what Jed said too, I actually had a conversation with a friend yesterday, just talking about more of kind of like the global experience that this is, and compared to anything else we've ever experienced in our history as humans, just like talking at that grander scale, this is the first kind of global event that everyone is actually experiencing. We talked about the closest things that could ever get to is kind of like the World Cup, but that's not like that same kind of hardship and trauma. But I think, I mean, and one of the big aspects of developing empathy is just being able to have a shared experience and realizing that you've been through a similar kind of event in your life. So I think this is actually could be turned into a positive, just to say, like, we've all been through this together. How can we use this momentum as a people, like as a human race, to kind of pull together and start bridging some of those gaps? And I think it's interesting because, like, we've had pandemics in the history of our species, but it's one of those things where we are the most connected we've ever been. We have the technology to really connect. And then there have been mentions of like to make sure you check yourself with the technology. But I think especially here, it's like a good opportunity to start thinking about how can we use that technology for good, to advance kind of like our connections with other people, like bridging the gaps just even beyond the Asian American population. How do we bridge like just different races? I mean, I think that's what we're talking about. How like it is a human experience. This time we're going through right now. So I think having that in mind is very important, kind of to have back in our heads, especially in light of microaggressions that might be going on. Maybe that's a starting point to try and think of like, oh, like how do we at least start to not combat it, but how do we start using this as a learning opportunity to interact with our peers who may not be as familiar with our personal experience, but this is shared amongst all of us. So yeah.
Yeah, thanks for sharing, Christian. Chris?
I'm just so glad we're talking about trauma. I think about it all day, every day, unfortunately. And to take kind of a step further in terms of, Jed, what you were talking about and what people have touched upon, I think that's been such a theme in terms of like my one-to-one clinical work with folks, is just understanding that this type of fear and panic that is sort of surrounding us, and to varying levels and different degrees to which we're all affected, I think is triggering a trauma response in so many individuals. And I think to understand how deeply rooted that kind of trauma is nuanced and so particular for each individual. But I think some of the things that I think of when I think of viewing things through a trauma response is understanding that when we are scared, our world is very small, which creates a sense of scarcity. And I think in the ways that people are talking about increasing empathy and being in environments around family in particular, which can be very triggering, I don't know about other people's families, is really trying to see their behavior as a trauma response or some sort of intergenerational trauma that has been unnamed, or for a variety of reasons has and cannot be addressed in this particular moment, and really trying to parse out the behavior from our perception and really seeing the behavior as some sort of survival response. So I think what has been helpful for me, whenever my mom, I think, has asked, you know, like, watch your wallet or something. I've been living in New York for 9 years. Thank God I haven't been robbed or anything. I'm always watching my wallet. But that has been a consistent sort of effort on hers to make sure that I'm financially stable, that I have a bank account, that I have a savings. But I think that comes from growing up in sort of abject poverty and not having enough. So really trying to understand, once I'm able to kind of see kind of past like the words that she's saying, that ultimately what she's trying to communicate is a sense of stability, some sort of security, and a parenting that maybe she feels at a loss of, because I do live so far. They live in California or Washington now. So just the ways that we're constantly having to negotiate new ways of communicating, new ways of connecting, I think brings up all kinds of old stuff. So I think what has been helpful for me and what's helpful for my clients is really trying to broaden that scope, and thinking that, again, when we are scared, our world is very small. Everything needs to be within arm's length. Everything needs to be within reach. We have to have enough. What are some ways that we can kind of reality test to bring the fear down?
No, yeah, it's awesome. Thanks, Chris, for sharing. So kind of wrapping and bringing this full circle, you know, we talked about what the challenges were, maybe some of the issues that we're experiencing in our immediate circles and the community at large. What are some things that we can do moving forward, right? That we can start to pick up maybe some new hobbies at home that can help us to address some of these like anxieties or issues with our parents or family members, right? Are there kind of routines that we can start to get into, right? That become a way to combat this. So yeah, we'd love to hear also like things that maybe we can do as individuals, but also as a community.
I notice we have a lot of other people. If someone's interested in just speaking up, I see there's an active chat, but it would be lovely to hear your voices as well. No pressure.
Oh. Did you have something to say, Deepankar?
Oh, my bad. I forgot to turn up the hand thingy. My bad.
All good. Yeah, Henry?
That we may not just think about just fully on a just as salient as all the other things that are happening in the world are taking care of what in DBT we call the please skills. So it's taking care of your physical health. Eating and you're sleeping. And that's in the most basic sense what we need to live, but we don't really start to think about that even especially in times of crisis. And so taking care of yourselves means taking care of the eating, sleeping, and exercise. And also, I know some people that are resorting to like smoking weed to get through this, to manage their anxiety. Moderate that, and so that you come out of it still being able to function. That's what I would suggest.
Andrew?
Yeah, I think just to, on the other side of that coin of what Henry mentioned, self-care, right, those pre-skills, also the community care piece. I think this case in point, right, having those sessions, you know, so thankful for technology now and really capitalizing on that, using that to our advantage by reaching out to our loved ones, friends, you know, across through Zoom, through FaceTime. You know, with this social distancing, that doesn't mean that you can't connect. You know, and so I think this is definitely that platform for that community care. Another resource too that I overheard is that Headspace, sort of a mindfulness app, is providing free services for all clinicians for the rest of 2020. I think all you have to do is provide your NPI number, and yeah, you can I guess have unlimited free subscription to Headspace, that mindfulness app. So if you think that works for you, you want to try that out, you might give it. Thank you.
Awesome. Thanks for sharing. Kisu.
Just wanted to make sure this is unmuted.
Yep, we can hear you.
Yep.
Cool. Well, first, it's nice to be at a discussion where, like, I know that my name will probably not be mispronounced. But I think another thing that I was thinking was, I think in the context of like the Asian American and slash broader Asian diaspora experience, there's often discussions of trauma, and I think it's useful to have that, but I also wonder if there's ways to highlight the more constructive elements, like was brought up earlier, like with community or something in light of this current, I guess I'm struggling to put it together, but it does feel like everyone's kind of still approaching it from a very individual, especially because like we have to isolate. Like how are we handling it individually? And I'm wondering if there's something like about the Asian diaspora like experience that like is actually able to like help us through this like period of uncertainty.
No, yeah, and thanks for sharing that. I think we can certainly ask the group, right? Because this is where everyone has the maybe the resources or the networks or the connections to do that. Yeah, so feel free to, let's also kind of continue the conversation in the chat room. But yeah, thanks for sharing, Kisu. And Dan.
Hey, so I mean, I think right now a big thing that's going on is really we're really kind of realizing our own boundaries, I guess is the right word, as we are part of this new norm. So we're looking into what is our relationship to loneliness, what is our relationship to our social network, who's the one who's reaching out, am I the one reaching out? And I think sometimes there's a lot that can go into that. And so, you know, I think in light of, you know, this idea of community care, I think I was reading some stuff about how, you know, we call it social distancing, but it's really physical distancing. You know, like this is actually a time for us to come together in just new ways. And I would, you know, recommend that people would just reach out to people that maybe you haven't talked to. I know there were some memes about how people are dating, and then on like these dating apps now, and then like the people that you didn't talk to months ago are finally coming out of the blue, and then you can have like an online relationship and stuff like that. But like there's a lot of different ways of really kind of thinking about this, and I encourage it to be part of a conversation among your peers. And you know, I hope for more spaces like this to be created so that the people who might not have who might realize that they don't have people who are in their network to really go to, so that they could become part of something. You know, I want to shout out to the Subtle Asian Mental Health sandwiches little group that I'm a part of, and they're watching this and participating in the chat.
Hey.
Yep, Steph. I think Alina is there too, and Alina actually planned a stay in and take out event for today. So people can order Chinese and other local, from other local restaurants, deliver and have like virtual hangouts, you know. And I want to also think about, you know, just the idea of, you know, for me, I know that the media and the constant barrage of updates sometimes can make people anxious. You know, I kind of like, you know, hurricane season when I was younger, and I was really on that. So right now it's kind of, I'm like thriving looking at news and whatnot, but I know that's not what other people are experiencing. And so one thing that you can also do to help yourself is just to limit that amount of time to like maybe once a day for like half an hour or something like that. And you can consume all the media you want regarding the coronavirus and worry all you can during that moment, and just like put it aside. You know, and that's just like a helpful tip that I know people have thought about. And, you know, I look forward to hearing other helpful tips from people as well.
Awesome. Thanks for sharing, Dan. And yeah, let's continue the conversation in the chat room. I want to like shift the conversation a little bit to, we have two medical, you know, people in the field who are seeing this as well as like kind of breathing this. And I wanted to kind of hear from their perspective, like, are there guidelines that, you know, we should know as a community and as a group? You know, washing our hands, like elbow bumps, right? Like these are like practical tips that we can use, but just want to hear from you guys. Like what are some of the things that that you've seen, but also that has been working and we should be like constantly doing. So Winnie and Anna, yeah.
I guess I can start it off by just giving a little briefing about what my hospital is doing. So I work at the NYU Langone Hospital in Brooklyn, which has become one of the organization's testing centers. And I've been keeping updated through emails and hearing that they've done a few things such as limiting. First, initially they were screening visitors and checking them for symptoms such as fever, cough, and then now we're restricting visitors completely just to continue that to limit the exposure to patients and other healthcare workers. And this is like one of the CDC guidelines. I'm sure you guys have heard that referring to the CDC guidelines is something that you should be doing and using reliable sources. And if you are experiencing symptoms like fever, cough, shortness of breath, to call your healthcare provider first. Or if you suspect you've been in contact with COVID, to call them first, just to limit the overload that's been happening at emergency rooms all over hospitals. And then if you have worsening symptoms, to call ahead to the emergency room. And if you develop any serious warning signs, seek medical attention immediately, 911, all that sort of stuff. But just like things that everyone's probably already heard about, social distancing is, or physically distancing yourself to limit the exposure, to stay home and avoid public transportation if needed, is very important, just because even if we are young and healthy and we might be less at risk compared to the elderly and those who are immunocompromised and more vulnerable to developing serious symptoms and requiring hospitalization, the degrees of exposure, if you limit that, then you're potentially saving someone else's life, and to decrease the overload that the healthcare system is facing, because there are limited resources, there are limited staff, there are limited protective equipment, there's a shortage of everything. It feels like, yeah, everything. And the basic things such as washing your hands for 20 seconds. These are all like from the CDC guidelines and things that I've gathered from other sources. Washing your hands for 20 seconds, using hand sanitizer that has at least 60% alcohol, avoiding touching your face, eyes, mouth, nose without washing your hands first. Cover your mouth and nose with a tissue if you're sneezing and coughing. Wear a face mask when you're sick and if you need to go out and come into contact with other people. Disinfecting surfaces, your phone, which was something that we touch a lot.
People.
Clean your phones, yes. And if you do, it seems like a lot of us are living at home or with other people, with parents, family. If you are sick or if you are experiencing any symptoms, avoid sharing personal household items like eating utensils, drinking glasses, dishes. Yeah, to just limit the spread. And those are just like some of the guidelines. And going off of what everyone said before, though, I think definitely setting boundaries and communicating with others that, you know, I need some space for myself is very important. Just even if we are taking care of ourselves physically, mentally is just as important, as we've all reiterated in this conversation, and to stick to a routine. I think for those who are working from home, to stick to some kind of routine that so it kind of mimics what your life would be like if you weren't confined to being at home, is important. So yeah, that's some of what I have to say, but Anna has more to share.
I 100% agree with everything that Winnie just said. It's a great overview. I did just say I think everyone's been like totally inundated with a lot of this information. Something that I've heard a lot of questions about regarding face masks. So I have a lot of family members. My father and my brother both work at Kaiser in California, and the current guideline is still face shields and surgical masks, even for surgeons who are working on confirmed positive COVID patients. So if you're worried about not having an N95, I wouldn't be super concerned. As of now, they're still saying it's droplet, not airborne transmission. So just covering your face with like the surgical face mask is totally fine. Just on my experience in the hospital, I was working in the psychiatric crisis center in the ED right before we got pulled out. And I did just say we got so many patients, so many people who were all experiencing very similar things, who were all feeling very anxious, very paranoid, a lot of increases in depression, suicidal ideation. Not to like put a damper on things, but just to say that everyone's kind of going through a very similar thing, and you know, you're not alone. There's a lot of resources, a huge upwelling of resources and stuff like this is really amazing. And yeah, there's a lot of people out there who sympathize. Yeah.
And no, like, thanks for sharing that, because I think there is a lot of misinformation, like you said. There's a lot of confusion, and that causes more anxiety, right? That causes more fears and panic. So I think having maybe concise things to do, like creating that routine, that habit, could be a really good start for us, for sure. So we're gonna close with an exercise. So at the beginning we said, hey, how is everyone feeling, right? And we did a 3-word exercise to just say, hey, mental health check, right? So quickly, let's just do a quick mental health check. How is everyone feeling? 3 words in the chat room. And you can message that to everybody. And so while we're doing that, how we're gonna wrap this up is with takeaways, right? So we wanna do some kind of like moving forward, what habit, right, are you personally going to do? Like, or a routine that you thought, hey, this could be really nice to start doing. Maybe it is an exercise routine. Maybe it is having a place in the house to just find some calmness, right? To do some meditation, right? To have your own time away from other family members or friends or kids in the house, right? And I think that could be a really good way for us to kind of summarize, right, and digest everything that everyone spoke about. All the panelists, that thank you so much again. Like, you guys shared such good insights to at least what's happening currently in our climate, but also like moving forward, right? Like, this is not just a one-time conversation, right? This is our daily life moving forward. So let's continue to write the 3-word of what you're feeling now, and then would love to hear maybe from the group, like, is there maybe a healthy habit or a routine or some kind of like takeaway that you guys got out of this?
And by this, it doesn't have to be like our conversation. It could be like the entire situation. Like, you picked up a new hobby, or you learned a new skill, or something like that.
Yeah, exactly. All right, so we got new hobbies like online courses, Udemy, reading more books, yep. Rollerblading, yes. Practice the social distancing though. Writing again, yeah. Yeah, sleep is it's so awesome. It's so underutilized. Reina, actually, want to share.
Hi, sorry, I just wanted to say, as we're talking about building new hobbies, I think it's important to also realize that we don't have to force ourselves to build in like a necessarily very productive habit. I feel like I expect myself to kind of do more now that I have more time at home, but I think building and integrating a new habit is still very challenging in itself. So I think going back to what Yuna had said at the beginning, allowing ourselves to explore it, but also not like force ourselves to be perfect in forming this new hobby or being able to reduce anxiety, because it's just normal to still have it fluctuate. And then also I wanted to comment on In terms of like cleaning the apartment or Marie Kondoing the apartment, I think I just wanted to link that back to how we had talked about sometimes certain objects have a lot of meaning, even if they're not as significant, like having enough eggs in the fridge or having enough paper. Like for some families, that is a sense of comfort. So I just know in general, in terms of like there's been some critiques of the approach for Marie Kondoing the apartment, that sometimes it doesn't necessarily apply to families who have experienced trauma. Not to say that it's not valid, it's just also there's some nuances in getting rid of things and cleaning a lot. Yes. But thank you very much for everyone, and it's good to see you all.
And thanks for sharing that, Rena. Carolyn.
I think, if you guys are anything like me, the hardest part of the day is definitely the morning and just waking up and getting started and feeling motivated, especially because usually one of the first things that I do is just check my phone and just, on my Facebook, I'm always just inundated by just news that's very fear-inducing. But there was one really interesting post that I read on Reddit the other day, and it was about like the importance of just, small routines, like, making your bed every day, so that even if, that maybe you're not feeling motivated or you don't feel accomplished, that at least you did one thing right. And I think that feeling can really snowball. And I also said on the group chat that the importance of grooming and showering is important for most people. I know it's really easy to just completely forget about that if you're not going to see people, but I think that really contributes to sometimes when you feel like you look good, then you feel better, and that can really snowball into doing other things. So that's one thing that's really helped for me, and I think it's a really big thing, for some people with mental health issues. To just do basic things like the ADL, the showering, the grooming, the eating.
Yeah, definitely. Just like those small incremental things that you do throughout the day, they're kind of like small victories that you can kind of give yourself that shot of like dopamine, like, oh, I did something, I accomplished something today, and it makes you feel better about like, oh, maybe I'm not so bad. Maybe it's not so bad, and it helps you to kind of keep moving. So yeah, thanks for sharing. How about you, Dan?
Yeah, I mean, I just want to also, reiterate what some people have already said regarding kind of at this time, people are also looking into their own relationship to productivity. And, we're basically talking about how there's so many changes in our lives. But I also want to also just validate the people who feel like their lives are not necessarily changing, that they're not really experiencing this as something that they have to hugely adjust to. And I want to affirm their own strengths in saying like, actually, this isn't that hard for me. And those people I know who have that experience as well. And I just want to affirm that, to say that you're not weird. We're not being like a lot of other people who are kind of thinking out to all these new changes. The second thing is that, as a social worker, I work with a lot of different types of people, and there are some people who are also just not updated on the current events, who are not noticing the way that things are changing in the world outside the, because of a mental health diagnosis, or because of their level of education or the poverty that they experience on a regular basis. Like, there are people who really aren't experiencing it in the way that other people are. And if anyone's interested in really also trying to figure out ways to reach out to those groups of people, I'd be, please, let's talk about that as well. Yeah.
Great, thanks for sharing, Dan. Christian.
And one of the things I actually want to address too is like for those folks who are more of the work from home type now, I think that's definitely, I mean, I'm in tech, so it wasn't too much of an unfamiliar experience, but there might be some folks who it's a whole new kind of thing to do. And I think one of the big things for me has always been just compartmentalizing my workspace and my home space. I feel like if you start to introduce the work stresses into your what's normally your relaxation place, it'll throw off your system entirely, and doing that for 30 days just won't be good for your sanity. So at least I've been trying to at least kind of make those mental designations in separate parts where it's just like, all right, this table is where I'm going to be doing my work. Trying to come up with a routine where it's like, all right, well, I change in my room. I highly recommend if you're doing the pajama work from home, I suggest against that. But yeah, just changing and then literally simulating in your mind like that I'm commuting to this table right now. So that way at least your mindset shifts into like, okay, I am at my workplace now. This is not home. And that has been helpful to kind of just change that, at least reframe my habits. So.
I think that's so important yet so hard to get out of your PJs and get into that habit. Because I'm guilty of that for sure. Awesome. So thank you guys all for again sharing, for keeping this as inclusive and as safe, and also supportive, right? And I think a lot of what was shared today doesn't just stay here, right? I'm hoping that these conversations, like in the chat room and everything that we've discussed, let's continue the conversation. And feel free to reach out to all of our panelists here. We'll send out kind of the list of the panelists who attended, but also some of the resources that we've been collecting as a group. And so, yeah, I just want to say, let's continue to stay together as a community, continue to talk. We're going to plan to do another one of these, hopefully in the next week or so, because I think this was really impactful and really powerful for us. So again, thank you guys. And we're going to leave this chat room open for now for people to continue to chat. But yeah, we're going to end our session here. So thank you all.